Welcome back to the show. I'm Ron Schakal with Shannon O'Kelly, and our first guest today is a naturopathic doctor, Bobbi Lutack with Evergreen Center for Integrative Medicine, and she's talking about Lyme disease today, Shannon. And Lyme disease, you don't hear a lot about it, but it really affects a lot of people.
Yeah, it's out there, and it's an interesting disease because it's so hard to detect and diagnose, and that's what Dr. Bobbi Lutack is going to talk about.
Here they are, Dr. Bobbi Lutack and Shannon O'Kelly.
Dr. Bobbi, welcome to Health Talk. How are you?
I am great. Thank you for having me.
Well, thank you for joining us. We're going to talk about our topic today, which is Lyme disease. But before we get there, I wanted to kind of talk a little bit about your practice. I noticed in your bio, it sounds like you treat anything from a simple ear infection to complex diseases. Maybe tell our listeners about how you became interested in medicine, kind of your practice. Give us the kind of the day in the life of Dr. Bobbi Lutack. How about that?
Okay. Oh, ever since I was a little kid, I was interested in medicine. And somewhere along the line, I thought I was going to become a physical therapist. That seemed close to what I was doing because I was very into sports. I was a runner and just an all-around athlete. And eventually, I became a sport physiologist and got a master's degree, and then all but my doctorate as a PhD. And I was on the track to be a professor. And what happened is I met someone who saw a naturopath, and I was like, what's that? So I think it was divine intervention. And I went to go meet this naturopath and have like a session with them. And from them, I met another one, and I was like, oh, this is what I want to do. And so that led me to Bastyr, which there were only like 2 schools in the country at that time that offered naturopathy as a degree. One was at Bastyr in Seattle, and one was in Portland. It was called NCIM at the time, National College. And then long story short, I was like a general practitioner seeing just all kinds of patients. And then my sister got Lyme disease, and I'm from the East Coast. And that was my introduction because it was a family member. And so we tried everything conventionally, and then we tried everything non-conventionally, and nothing was like working. They didn't even know what it was at the time, but it got diagnosed maybe quicker there because we're from New York and had a little bit more knowledge about it. And from that experience, all of a sudden, then it was, oh my gosh, it seemed like everybody had it. And then the pendulum swung to more in the middle, something to consider when you've been undiagnosed for a long time with a lot of symptoms and you haven't quite gotten to, it's not quite fitting into lupus or rheumatoid arthritis or whatever. You just have to keep digging.
Yeah, keep digging is the kind of the common theme with Lyme disease. What I know about Lyme disease, obviously it comes from a tick bite. It is predominantly located mostly on the East Coast. I suppose we've had some cases out here on the West Coast. Maybe we can talk about that. But before we talk about kind of, the demographics of the disease, you mentioned, if you've been sick or have some kind of illness for a long period of time, you probably should have it checked, and it could be Lyme disease. Maybe we can talk about kind of the challenges of diagnosing this.
It is hard to diagnose, and there's a lot of issues with that. I mean, first of all, 30% of all people remember actually even getting bit by a tick when you historically ask them questions. And only 30% of those people get any kind of a rash. There's very few people that get the classic, what they call the bullseye rash, which looks like a red target with a circle around it. When you get that classic bullseye rash, and it can actually happen not even at the site of the tick bite, it can happen on other parts of the body. That's what's known as pathognomonic. So if you have a bullseye rash, it's Lyme disease. And unfortunately, the CDC standard is some 2-tier testing. So they do like this ELISA test, which is only about 70 to 75% sensitive. These are blood draws. And so right there, you're missing 25 to 30% of people because it's not as sensitive. And then if that is positive, that one, or it's equivocal, then they do the Western blot. And so you have to be positive for both of those, or the non-Lyme literate conventional doctor will think that they did due diligence. You don't have Lyme. And the testing was never supposed to be for a clinical diagnosis. It's always been for surveillance, but most physicians don't know that. So if you don't have a positive Lyme test, boom, you don't have Lyme, you're out.
Well, Lyme disease is complicated to say the least. We're going to learn more with naturopathic Dr. Bobbi Lutack from Evergreen Center for Integrative Medicine after this on Como.